EMT Prometric Questions and Answers. Questions 121 to 140. 121. You should suspect potential abuse of a 4-year-old child when you encounter A. Bruises to the anterior tibial area. B. Curious siblings who are watching you. C. Purple and yellow bruises to the thighs. D. Clinging to the parent during your assessment. The answer is C. Purple and yellow bruises to the thighs. 122. A 30-year-old woman has severe lower abdominal pain and light vaginal bleeding. She tells you that her last menstrual period was 2 months ago. On the basis of these findings, you should suspect A. A normal pregnancy. B. An ectopic pregnancy. C. A spontaneous abortion. D. A ruptured ovarian cyst. The answer is B. An ectopic pregnancy. 123. Management of an 18-year-old woman with severe vaginal bleeding includes all of the following, except A. High concentrations of oxygen. B. Elevation of the lower extremities. C. Placing sterile dressings into the vagina. D. Covering the vagina with a trauma dressing. The answer is C. Placing sterile dressings into the vagina. 124. A sudden onset of respiratory distress in a 5-year-old child with no fever most likely is the result of A. Infection of the lower airways. B. Inflammation of the upper airway. C. A progressive upper airway infection. D. Obstruction of the airway by a foreign body. The answer is D. Obstruction of the airway by a foreign body. 125. The most important initial steps of assessing and managing a newborn include A. Suctioning the airway and obtaining a heart rate. B. Clearing the airway and keeping the infant warm. C. Keeping the infant warm and counting respirations. D. Drying and warming the infant and obtaining an APGAR score. The answer is B. Clearing the airway and keeping the infant warm. 126. Which position is most appropriate for a mother in labor with a prolapsed umbilical cord? A. Left lateral recumbent. B. Left side with legs elevated. C. Supine with hips elevated. D. Supine with legs elevated. The answer is C. Supine with hips elevated. 127. When is it most appropriate to clamp and cut the umbilical cord? A. As soon as the cord stops pulsating. B. After the placenta has completely delivered. C. Before the newborn has taken its first breath. D. Immediately following delivery of the newborn. The answer is A. As soon as the cord stops pulsating. 128. Which of the following statements best describes a mass casualty incident? A. More than 5 patients are involved. B. At least half of the patients. C. The number of patients overwhelms your resources. D. More than 3 vehicles are involved. The answer is C. The number of patients overwhelms your resources. 129. In addition to ensuring your own safety, your primary responsibility when functioning at the scene of a violent crime is to A. Preserve any potential evidence. B. Appropriately manage the patient. C. Notify medical control prior to initiating care. D. Obtain police permission before providing patient care. The answer is B. Appropriately manage the patient. 130. The initial treatment of choice for ventricular fibrillation of short duration, such as a witnessed cardiac arrest is A. 100% oxygen delivery. B. Prompt defibrillation. C. CPR for 2 minutes. D. Cardiac drug therapy. The answer is B. Prompt defibrillation. 131. While managing a patient in cardiac arrest, you turn the AED on and attach the pads to the patient. When you push the Analyze button, the machine signals low battery and then ceases to function. The patient subsequently dies. Which of the following statements regarding this case is most correct? A. You and your partner may be held liable for negligence. B. The crew that preceded you may be held liable for negligence. C. The manufacturer of the AED may be held liable for negligence. D. Most errors associated with the AED involve equipment failure. The answer is A. You and your partner may be held liable for negligence. 132. Following delivery of a newborn, you note that the mother has a moderate amount of vaginal bleeding. The mother is conscious and alert and her vital signs are stable. The most appropriate management of the mother includes A. Massaging the uterus if signs of shock develop. B. Administering oxygen and massaging the uterus. C. Placing a sanitary pad in the vagina and administering oxygen. D. Treating her for shock and providing immediate transport. The answer is B. Administering oxygen and massaging the uterus. 133. You are responding to a call for a 2-year-old child who fell from a second-story window. With the mechanism of injury and the age of the patient in mind, you should suspect that the primary injury occurred to the child's A. Head. B. Chest. C. Abdomen. D. Lower extremities. The answer is A. Head. 134. At the peak of the inspiratory phase, the alveoli in the lungs contain A. High quantities of carbon dioxide. B. Minimal levels of oxygen and carbon dioxide. C. Equal levels of oxygen and carbon dioxide. D. More oxygen than carbon dioxide. The answer is D. More oxygen than carbon dioxide. 135. Pulmonary surfactant serves which of the following functions? It carries fresh oxygen from the lungs to the left side of the heart. It dilates the bronchioles in the lungs and enhances the flow of air. It lubricates the alveolar walls and allows them to expand and recoil. It facilitates the transport of oxygen-poor blood from the right ventricle to the lungs. The answer is D. It facilitates the transport of oxygen-poor blood from the right ventricle to the lungs. 136. You receive a call to a restaurant where a 34-year-old man is experiencing shortness of breath. When you arrive, you immediately note that the man has urticaria on his face and arms. He is in obvious respiratory distress, but is awake and alert. Suspecting an allergic reaction, your first action should be to A. Ask the patient if he has an epinephrine autoinjector. B. Remove the patient's shirt to inspect his chest for urticaria. C. Obtain a set of baseline vital signs and a sample history. D. Place a non-rebreathing mask set at 15 liters per minute on the patient. The answer is D. Place a non-rebreathing mask set at 15 liters per minute on the patient. 137. You receive a call to a restaurant where a 34-year-old man is experiencing shortness of breath. When you arrive, you immediately note that the man has urticaria on his face and arms. He is in obvious respiratory distress, but is awake and alert. Epinephrine possesses which of the following effects when it is used to treat anaphylaxis? As a vasodilator, it increases blood pressure. As a vasoconstrictor, it lowers the blood pressure. As a bronchodilator, it facilitates adequate breathing. As a bronchoconstrictor, it inhibits the release of chemicals that cause the reaction. The answer is C. As a bronchodilator, it facilitates adequate breathing. 138. You receive a call to a restaurant where a 34-year-old man is experiencing shortness of breath. When you arrive, you immediately note that the man has urticaria on his face and arms. He is in obvious respiratory distress, but is awake and alert. The patient tells you that he does not have his own epinephrine, however, his wife is allergic to bees and has a prescribed epinephrine autoinjector. You should next provide transport and consider an ALS rendezvous. Assist the patient with the wire's prescribed epinephrine. Obtain consent from medical control to give the wife's epinephrine to the patient. Assist the patient with 1/2 the usual dose of the wife's epinephrine. The answer is A. Provide transport and consider an ALS rendezvous. 139. An elderly man is found unconscious in his kitchen. The patient's wife tells you that her husband has diabetes and that he took his insulin, but did not eat anything. You should suspect A. Ketoacidosis, B. Diabetic coma, C. Hypoglycemia, D. Hyperglycemia. The answer is C. Hypoglycemia. 140. Which of the following statements regarding the function of insulin is most correct? A. It stimulates the liver to produce glycogen. B. It promotes the entry of glucose from the cell into the bloodstream. C. It facilitates the uptake of glucose from the bloodstream into the cell. D. It causes the pancreas to produce glucose based on the body's demand. The answer is C. It facilitates the uptake of glucose from the bloodstream into the cell.